Alisha Alderson packed her folded clothes and everything she needed for the last month of her pregnancy into various suitcases. Just a few weeks before her due date, she never thought she would have to leave the comfort of her home in rural Oregon. But after the only birthing center within 40 miles suddenly closed in August, she decided to stay at her brother's house near Boise, Idaho, a 2-hour drive across a mountain pass. To be closer the hospital. Alderson stated that the maternal age is 45 and said, "We do not feel safe because we are so far from the birth center. I was sitting in hair salon and some people started making jokes about me giving birth on the side of road. And at that moment I imagined everything that could go wrong with my baby and I burst into tears in front of strangers." A growing number of rural hospitals are closing labor and delivery units, forcing pregnant women to travel longer distances for care or have to give birth in the emergency room. Less than half of rural hospitals now have maternity units, leaving government officials and families scrambling for answers. One solution gaining ground across the U.S. is freestanding midwife-led birthing centers. But they too often rely on nearby hospitals when serious complications arise. The closures have exacerbated so-called obstetric care deserts, counties with no hospitals or birthing centers offering obstetric care and no obstetric providers. More than 2 million women of reproductive age live in these mostly rural areas. Ultimately, doctors and researchers say the decreasing number of birthing units in hospitals makes having a baby less safe. One study showed that rural residents were 9 more likely to face life-threatening complications or even death from pregnancy and childbirth than those in urban areas. And less access to care also played a role. Mothers everywhere have complications. Babies have complications all over, said Dr. Eric Scott Palmer, a neonatologist who practiced at Henry County Medical Center in rural Tennessee before obstetric services ended this month. There are going to be people who are harmed. Reasons behind the closures. The problem has been brewing for years. The American Hospital Association says at least 89 maternity units were closed in rural hospitals between 2015 and 2019. More have since closed. The main reason for closures is decrease in number births, personnel problems, low reimbursement from Medicaid, federal state health insurance program for low-income people. That financial strain, said Peiyin Hung, Deputy Director, University South Carolina Rural and Minority Health Research Center co-author study, which was based on a survey hospitals. Officials at Saint Alphonsus Hospital in Baker City, where Alderson wanted to give birth, cited the lack of obstetric nurses and the decrease in births. When safe staffing is not provided, the consequences are devastating. While they said that financial concerns did not factor into this